probably the most critical component of the healthcare system. When it works well, other bits of the system sort of stand a chance of operating effectively. But when primary care starts to break down, then all parts of the system feel it pretty quickly. And traditionally, satisfaction with primary care has been very high. It's been the bit of the NHS that consistently gets very high satisfaction scores from patients, but has been declining fairly steadily over the last 10 years or so. And GPs themselves also report less satisfaction with their work life, and recruitment has been problematic over the last 10 years or so too. And I think there's been more tension in the system between the primary care aspect of our healthcare systems and secondary care now than I can ever remember it. I mean, it's always been a tense relationship, but I think tensions are running particularly high at the moment. And then to sort of add into the mix, primary care has seen a lot of change over the last few years. If you were to go back 20 years, almost all consultations that patients had with their GP practice would have been in the surgery and with a GP. And that's not the case anymore. A significant number of consultations are delivered remotely by telephone or video conferencing type applications, messaging systems, or being delivered by nurses and other healthcare professionals. So there really has been a big change in the way primary care has been delivered over the past 20 years. There were trends before the pandemic, but they were really accelerated during the pandemic. So it feels like a really important area for analysts to get involved in, and it's not something I don't think we don't do maybe as much analysis of primary care as maybe we could or should do, and that's traditionally been, I think, because of lack of access to data. And the MDSN have asked us to do a piece of work on the topic of primary care. And I've been working away on that, and I'm going to be producing or publishing 3 short reports over the next month or so that address these 3 topics. But first one is about long-term trends in GP practice consultation rates. The second is about the gap between need and supply of GP practice consultations. And the third is about what's happened to GP practice productivity and continuity of care, and how those two concepts relate to each other. I'm going to focus today on the first of those, which might seem a bit of a prosaic topic, what's happened to the numbers, but it feels like a really fundamental question if we're going to get a deep understanding of what's happened to primary care, to understand what's happened to consultation rates over the long term. And I'm going to focus mainly on the results of the analysis rather than on methods, but I'm happy to pick up those sort of questions in the Q&A or after the call, if that would be useful, if you want to email me. And I'm happy to come back and present the findings of the other 2 on the other 2 reports at a later date if people are interested in what we do, or alternatively to give me a call and I can speak to you individually if that would be useful. So before I kind of get into the detail, I wondered whether I might ask you to do something. So this is a deliberately blank chart. On the y-axis, the vertical axis, what we're looking at is the rate of consultations per patient per year. And on the x-axis, the horizontal axis, we're looking at time running by year from 1995 through to 2022. And I wondered whether I might ask you to, if you have a piece of pen and paper in front of you, just to jot down those 2 axes on a piece of paper and attempt to draw a line through that chart, which represents your prior beliefs about what has happened to GP practice consultation rates over this period. So the line will run from left to right, indicating the trend in GP practice consultation rates over this period. And as well as drawing a line through the chart, I wondered if I might ask you to just put a number at the very end of your line, indicating what you think the rate of GP practice consultations is in 2022 at the end of the period. So I won't be asking, there's no test on this later, there'll be no sort of prizes or anything else for getting it right or wrong, but I just thought it's useful to, before I show you the results, for you to set out to think about what you think might have been happening to this variable over time. what's your either belief or your intuitions about this rate and how it might have changed? Right. So obviously, when you were sort of embarking on a question like this, what's happened to GP practice consultation rates? There's always prior studies, other pieces of work that people have done, which give you some insight into this question, that they sort of fall into three groups. There are some studies that come from surveys of patient recall. So surveys that ask patients, when was the last time you saw your GP, or when was the last time you had an appointment at your practice, or how many times have you seen your GP over the last 12 months or 2 years, for example. And for many, many years, that was the main source of information we had on levels of activity in primary care. And they're useful, but they rely on surveys, which are quite costly, and they're also subject to bias because we know that patient recall isn't always perfect. But nonetheless, those studies have been around for a long, long time. They're used in the Health Survey of England. The GP patient survey, for example, asks a question that will give us some information about how often patients access their GP practice. And then about sort of 10 or 15 years ago, researchers started publishing papers on GP practice consultation rates, which were derived from research databases, and I'll talk about more of those in a minute. And then most recently, over the last few years, NHS Digital have started doing some routine reporting of GP appointment rates in primary care. Appointments are maybe slightly different to consultations, but they're a very closely aligned currency. So all of those three sources of information are available to us. But none of them give us a complete picture of the long-term trends between 1995, for example, and the present day, which is what I've been trying to address in this piece of work. So the research databases that I mentioned, there are several of them. These are sort of curated databases that are made available to researchers for particular purposes, and they usually draw a sample of patient records or patient records from a sample of practices across the country. You might have heard of some of these. CPRD, for example, is a very well-known sort of research database. Ben Goldacre's system is called Open Safely, which was originally developed just for COVID purposes, but I think more recently has got permissions to do research for other purposes as well. And they each in turn, as they draw data from GP clinical information systems. Those top three research databases all draw data from a sample of EMIS practices. The two in the middle draw data from TPP, System 1 practices, and the last two draw data from vision practices. And I said that researchers have been using those research databases to examine consultation rates for some time, and there are 5 studies that I'm aware of. The first was published in 2009 by Julia Hipsley Cox, and then there were 3 papers published around the same time, 2 by the think tanks and 1 by Richard Hobbs from the University of Oxford. That Hobbs paper is the one that's most widely cited. And then more recently, the Health Foundation published a paper on GP practice consultation rates in 2023. And I'm going to show you what the results of those 5 studies are now, so we know what sort of our baseline understanding is. So these are the first 4 studies that I mentioned. And so you get a sense of the level of GP practice consultations that these were estimating and the trends that were in place over the period from 95 through to 2012 or 13-ish. And so the first observation is that the studies are all estimating very different rates. So some estimating rates down around 4 in 2010, for example, others estimating rates closer to 7. So very different estimates of the rates of consultations going on. And that's not because there's anything wrong with any of these individual studies. It's simply that estimating or defining a consultation in GP practice systems is not straightforward, and there are lots of different ways to approach that question. So there will be consistency within each of these studies about how they define consultations, but obviously differences across the studies and how they've done that, and that leads to some uncertainty. But at least over this period, all the studies have consistently estimated increases in rates. So although they estimate different rates, they're all estimating that rates were increasing over these periods. So that gives us some confidence in terms of what was happening. And then the fifth paper that I mentioned was published by Emma Vestesen from the Health Foundation very recently. This paper was published. And she reported rates that were at or below levels in 2018, levels that were lower than most of the studies were reporting back in 2010. But it's difficult to know whether the difference that we're seeing in the rates that Emma has published were due to differences in definition, or whether they indicate that consultation rates might have declined over the period from, say, 2012 to 2019.
Stephen, are you okay for interruptions?
Of course, yeah, no problem.
It's a bit late to say no. No, I just realised that I raised my hand, but I don't think you can see that. Mohammed asks if these are case mix adjusted or crude rates. I suspect they're crude rates, but I just thought if we could just confirm that now, that would people won't have to ask that question.
Yeah, it's a really good question. I should have said these are crude rates, so that don't take account of, they take account of the change in the population size, but not of the age or sex or other factors within the population.
Okay, thanks.
So the other thing that from Emma's paper is that she reports a very, very large increase in consultation rates between 2010 and 2011, a bigger increase than in-year increase than we've seen reported anywhere else in the previous trends. So that really seems important finding there, really. But what we don't have is a consistent estimate of consultation rates from a single source or multiple sources over that period, and that's what I've attempted to do, to try and to give us a single line running through the chart from a single source so that we can get a better sense of what's happened to consultation rates. So I've used these two research databases, CPRD Aurum and CPRD Gold. CPRD Gold draws data from a set of vision practices, and CPRD Aurum from a set of EMIS practices. CPRD Gold is a much longer standing research database, very well curated, very well understood. But unfortunately, in recent years, the number of practices that are using the vision system has declined, so its coverage has also declined. CPRD Aurum is a much newer research database, so much more uncertainty about the values in those data sets, but it's a much larger data set to draw on. So what I've done is I've drawn samples from each of those two databases. These are enormous databases with, many millions of patients in each of them, but I've drawn a year stratified exposure weighted random sample from each of those two databases with about 20,000 patients per source per year. So across the two databases and over all the time period from 95 to 2022, there's about 1 million patients in total in my sample. And then I've built models from each of those which try to understand how the rate of consultations is affected by year, age and sex of patients, and how long they've been registered with their practice. And then I've used those models to try and estimate consultation rates for the population as a whole by putting those together with population estimates by age and sex. So I won't talk much about the detail of what I've done, but again, happy to pick up those sorts of methodological questions in the Q&A if people want to do that. So I'm going to sort of reveal the results in three sections. This first section is the period from 1995 to 2012, and both the two databases, the analysis from CPRD Aurum and CPRD Gold, show consultation rates increasing over that period, and that sort of confirms the findings of those earlier studies that I mentioned. So sort of comforting, I guess, that the results from this analysis correspond pretty closely with the results of the earlier studies. But then between 2012 and 2019, our analysis suggests that consultation rates per head of population actually reduced. So levels of access to this service reduced relative to the size of the population that it serves. And I don't think there's been another study that has shown this decline. I mean, we could maybe deduce it from seeing the point at which the most recent Health Foundation study started, but I think this is useful confirmation of that. And then the period from COVID onwards, 2020 onwards, this is what the results look like. So we get really, really different results from the two data sources. CPRD Gold suggests that consultation rates continue to decline after the pandemic, whereas the results from CPRD Aurum, which is also the source that Emma Vestesen used in her analysis, showed quite a sharp increase in consultation rates between 2020 and 2021. So we have a sort of real dilemma here about what do we think has really happened to consultation rates. Of course, it's possible that consultation rates in vision practices were very different from consultation rates in Aurum practices, but that seems quite unlikely to me. More likely is that one of these two trends is closer to the truth than the other, at least from a patient experience. And the rest of the slides I'm going to present today, I'm really trying to understand which of those two trends we should believe or trust most when we're trying to understand what's happened to consultation rates since the pandemic. So again, just to reiterate, we've got sort of reasonably good knowledge of what's happened in this first period between 1995 and 2012. I would say good and new knowledge of what's happened to consultation rates between 2012 and 2019, but really not knowing how to interpret the results we've got since 2020. So there are a bit more information I can share with you. So consultation rates are consultations are either delivered by GPs or nurses or other healthcare professionals in the practice. And the divergence between the two sources is present for both GP and nurse and other healthcare professional consultation rates. We can also cut consultations about in terms of whether they were delivered face-to-face in surgery or via home visit, or remotely over the telephone or video consultation. And that seems to be where the discrepancy arises. The two data sets provide very, very different results for the rate of remote consultations that have occurred since 2020. So it seems that understanding that difference is key to understanding whether or not we can believe the CPRD Aurum or Gold results more. So I mentioned earlier that there are other sources of information. I've been talking about these research databases, and those are the ones I've been using as well to do my analysis. But there are also surveys of patient recall and the newer data from NHS Digital on appointment rates through routine reporting that they've been carrying out more recently. So I'm going to show you what those results look like now. So see if they can give us a view on which of the two trends, more recent trends, are more credible. So first of all, there were other sources as well. So whilst there are events that happen commonly alongside a consultation in a practice, in particular, prescriptions are issued and referrals are made. So we can look at whether trends in those might give us some indication of what's happened to consultations too. And there's also data on GP workforce and workload surveys, which I'll talk less about today, but I can give you an indication of what they're suggesting as well. But either way, I'm trying to give, I suppose, a sense of, if we take account of that wider set of information, does this lead us to believe that consultation rates increased after the pandemic or have continued to reduce? So these are the research databases that I mentioned earlier. NHS Digital have also been drawing data from EMIS, TPP and vision practices on a routine basis since the end of 2018 and reporting those as appointment rates on their website. So there's data on the more recent period on appointment rates in practices. And that's what I'm going to show you first of all. I'm going to show you what those appointment rates look like. Not all appointments are attended, so some are DNAs. So I've excluded the DNAs and I'm reporting the rates of appointments that were attended from NHS Digital. So the green and black lines are the previous trends that I showed you. Those are my estimates from CPRD Gold and CPRD Aurum. And the orange line on this chart is the appointment rates that are reported by NHS Digital, and they they kind of bisect the two trends. They're not quite the same as what we're getting from CPRD Gold or CPRD Aurum. In 2019, the rates were very, very similar to both CPRD Gold and CPRD Aurum estimates. But since then, they've been broadly the middle of the road between Aurum and Gold. And it's worth saying that if there is an issue with the way consultations and appointments are classified in Aurum or Gold, then NHS Digital might be suffering from the appointment rates that NHS Digital report might be suffering from the same problem. So I don't think this gives us a clear answer, but probably it suggests that appointment rates probably increased. That's what NHS Digital figures suggest, maybe corroborating the Aurum data more than the Gold data. So what about patient-reported access to primary care? So in the GP patient survey, there's a question that asks, when was the last time you saw your GP or a nurse at your practice? And that question was asked consistently between 2011 and 2017. And since 2012, there were kind of reductions in the proportion of patients that said they'd seen their GP in the last 3 months. And maybe a slight decline in the proportion of patients that said they'd seen their nurse in the last 3 months. After 2017, they changed the form of the question. They simply asked, did you have an appointment with anybody at your practice? And those rates look like this. They were also declining in the period from 2017 to 2019, big dip during the pandemic year, and haven't recovered to levels before the pandemic, even by 2023. So this would suggest a sort of continued decline in consultation rates, more along the lines of what we saw from CPRD Gold. The other thing I mentioned that we can look at is other sources of information on activities within primary care that might be aligned with a consultation. So prescriptions are issued commonly when patients have consultations, and referrals are also made during those consultations or as a result of those consultations. So if we understand trends in those, it might give us an indication of which of the two consultation rates we can believe the most. Well, prescriptions have been going down for quite a while, and in 2021 we're still well below those pre-pandemic levels. I should say that prescription items, the items on the individual prescriptions, have been going up. So there's certainly been more items prescribed, but the process of writing a prescription, the individual prescriptions, the rate of those themselves have been going down. So GPs generally are writing more items on each prescription they prescribe. So that might corroborate the CPRD Gold data more. Referrals are also down on what they were before the pandemic. Again, referrals tend to happen as a result of a consultation. So again, that might support the CPRD Gold data more. So I mentioned there's also some information on GP workforce and GP workloads. I'll just tell you what that says very quickly. So the number of GPs, full-time equivalent GPs, hasn't really changed very much. Sorry, the number of qualified permanent GPs hasn't changed very much. If anything, it's declined somewhat since 2015. But the number of practice staff in total has gone up quite considerably. And when you ask GPs what they spend their time on, they report spending a smaller proportion of their time on direct patient interactions. So again, that might support the CPRD Gold data more than the CPRD Aurum data. So my conclusions from doing the piece of work is that, sort of corroborating earlier studies, we found an increase in consultation rates between 1995 and 2012. In the period from 2012 to 2019, our analysis suggests that consultation rates fell, reversing the gains that were seen since 2008. And then from the period from 2020 onwards, the two sources of data that we use to estimate consultation rates produce very different results. One showing an increase, the other showing one showing continued decreases, the other showing a rapid increase. But having looked at the other sources of information available to us, patient surveys, the sequels to consultations in terms of referrals and prescriptions, it seems to us more likely that consultation rates have continued to reduce than it is that the consultation rates increased. And the uptick in consultation rates seen in the CPRD or Aurum data, and also seen in NHS Digital's appointments data, I think is more likely to be an artifact of recording processes, and in particular the adoption of electronic messaging systems that GP practices use these days to communicate with patients. It doesn't seem to me that those sorts of interactions are recognised as consultations or appointments by patients, and they don't tend to lead to the common sequelae of consultations in terms of prescriptions and referrals. So although there's a lot of uncertainty about what's happened since 2020, I think it's probably safer to assume that meaningful consultation rates have continued to reduce since then, rather than have increased as the CPRD Aurum data suggests. So just to confirm, we've got this clarity on the period between 1995 and 2012, and I think new information on what's happened between 2012 and 2019. Uncertainty about what's happened from 2020 onwards, but I think it's more likely that rates have continued to reduce than they had than the sharp increase that we see in CPRD Aurum. And a bit about the implications for ICBs. So all of these results I've been presenting have been at a national level. That's one of the limitations of these research databases, is because they're samples and because of for pseudonymization and privacy purposes, we can't identify individual practices, and so we can't associate a practice with an ICB. So we can't estimate rates below the national level, or at least below regional levels. So really, unless you've got some local data on what's been happening with consultation rate trends in your local area, it's probably safe to work on the basis that consultation rates fell between 2012 and 2019. That reduction we saw nationally probably occurred in each locality. And I say that because the factors that will be influencing these trends are predominantly national. They're about workforce recruitment and about national policy and funding, rather than about local policy decisions about primary care. Until recently, the sort of funding arrangements for primary care have been determined largely nationally. And now NHS Digital report that for 10 of the 11 ICBs in the Midlands, they report an increase in attendance rates since 2019. And the question is whether ICBs should be reassured by this. Apologies for the spelling mistake there. I'll show you what I mean. So on the right of this chart, we're showing the increase in appointment rates that NHS Digital are reporting for each of the ICBs in the Midlands. So you'll see for 10 of the 11 ICBs, NHS Digital are reporting increases in appointment rates, and that that's been in the public domain for quite some time, and I think people are taking some reassurance from that. But if we compare that with what patients are saying through the patient survey, over the same period, they're showing that they are seeing their GPs and other healthcare professionals at their practice much less frequently than they used to. They're all reporting substantial reductions in the frequency which they see their GPs. And I think, on balance, looking at all of this data, I would urge ICBs not to trust the NHS Digital appointment data too much in and of itself, without looking at other sources of information. I think possibly those increases in appointment rates that we're seeing in NHS Digital's data might just be an artifact of the way we're recording consultations, and in particular the increase of these new messaging systems that GP practices are using. So I mentioned that there's 3 reports that I've been working on. I've been talking today about the first one, about long-term trends in GP practice consultation rates. The other 2 reports are trying to get a better handle on what's happened to the gap between need and supply of GP practice consultations, and in particular how we can understand what's happened locally within each ICB. And then the third report is looking at GP practice productivity and continuity of care and the relationship between those two concepts. And Rachel, happy to do presentations at future huddles on those two other topics if people are interested, or if people are interested in what these reports are saying, then please get in touch with me and I'm happy to talk you through what the results are. The plan is that we're going to publish the reports in the next month or so on our MDSM website, but the reports will go to the chief analysts in confidence first for them to get a view on the content of the reports and to offer some feedback. So that those reports are going to chief analysts in the next couple of weeks, something like that. Thank you. That's everything from me. Happy to answer any questions that people might have.
Thank you very much, Stephen. I was just thinking, you got a lot of people applauding you, as do I. Yeah, thank you as usual for your time and for sharing this with you. I think you soon after you'd finished the work, you did a presentation at Hacker, I think, on this too. So I was thinking that there is a couple of questions which I'll just come to in a sec. In fact, why don't I do that? Why don't I share my screen so you can see what people have said? One or two, I think we've probably covered as you went through your presentation. Can you see? You can see the screen.
Yep.
Do you want to pick the ones that you want to talk to?
Yep. So that first question about how a GP practice consultation is defined, I think that's kind of at the heart of all of this, really. Before I got involved in this piece of work, I kind of had imagined that would be something that would be easy to count from these research databases, that there would simply be a table of consultations and I would just count the number of entries in it, maybe excluding a few and including a few. In reality, there are consultation tables in these research databases, but most of the activity in those databases you would not think of as a consultation. They are patient-related activities, but not consultations in most cases. So they might be a letter has been received from the hospital about the patient, for example. That gets logged in this table. A letter has been drawn up to the patient. Document has been scanned into the system relating to the patient. So there's lots of things in that table that are not consultations, and working out which is a consultation and which isn't is problematic. And there's a lot of variation within practices about how they code and record these things, and between the clinical information systems and how they handle it, and also in terms of the research databases and how they curate that data. So there's lots and lots of uncertainty about what exactly constitutes a consultation. It's odd because as individual recipients of these services, we know exactly when we had a consultation, don't we? You'd be able to say when we have this, but identifying those events within these research databases is problematic. And I think if we're going to keep reporting and recording these sorts of activities, we need much better clarity, much more clarity and much more consistency nationally about how these events are reported and recorded. And there'll always be a little bit of uncertainty and ambiguity about that. But I think we need to get more consistency. If these metrics are going to be of wider use for comparison purposes over time and between areas, for example.
Okay.
So next point, I'll read down. I find it staggering given the levels of detail in hospital activity that we don't have a clear and easy national and regional picture of primary care activities. It is really strange, isn't it? I almost said that at the beginning. It's I suspect members of the public would expect us to know this and to know it really clearly, given how much we spend on this service and how important it is to patients and to politicians and to the service themselves and to the whole system, that we would have a really good handle on this number. But unfortunately, it is still something we're getting to grips with. And I think there's a lot of uncertainty about it, particularly in the more recent period. And so it's something I think we should put a lot of effort into improving our knowledge on. And you'll know the history of this. The history has been the reason why we haven't had historically really good knowledge of this system is because of concerns about patient privacy and the problems with care.data and other previous attempts to try and collate national sources of data on this topic. It does look like those are being slowly worked through, and that maybe in a few years' time there may be some national resource that analysts can access on GP practice consultations in detail, pseudonymized data sets like we have for hospital activity. And yeah, I think if we were to look again in 3 years' time at this, I think there might be real progress on this topic. But at the moment, it's you know, we're reliant on a range of disparate and incomplete sources of information. So could the difference in telephone consultation simply be a variation in two systems and the ease and quality of data recording? Yes, I think that probably is the case. That's my conclusion, that the way in which the two systems, EMIS and Vision, require GPs and other healthcare professionals to record telephone and other remote consultations is different. Aligning those two across the systems is very, very challenging. But I think that's something we're going to have to crack if we're going to meaningfully report remote consultation rates, which are such an important part of GP practice provision now in the future. We've got to crack that in the future. Yeah. I know you might cover this in future sessions, but what are the main implications of these findings? Maybe I can give a brief taste of what the other two reports I get at. So
yeah, that'd be helpful.
The second report in the series is about what's happened to the relationship between need and supply of primary care consultations. Now, over the period between 2012 and 2019, we've got some clarity on what's happened to consultation rates. Both the two systems are reporting declines in consultation rates over that period. And it's probably not surprising to hear that need for GP practice consultations has gone up. The population has aged, and older people tend to use GP practice consultations much more frequently than young people do. And levels of morbidity relative to age have also increased slightly over that period. So, you know, even after you adjust for age, people report higher rates of long-term conditions than they used to, and long-term conditions give rise to GP practice consultation, the need for GP practice consultations. So we've got a decreasing rate in consultations and an increasing rate in need. So a gap is opening up between need and supply. And we can estimate that gap, and that's what I try and do in the second paper. The overall scale nationally, how many GP practice consultations are we short, for example, over what we should be, and how is that distributed across ICBs? What are the implications of that for other parts of the healthcare system and for patients? That's what we try to unpick in the second report. Okay. And then the third paper looks at productivity of GP practices and continuity of care. So productivity has been declining more recent years. It had been increasing for many years in primary care, but it has been declining by most measures. That's their sort of simple input-output measures. So, you know, how much resources available to practices and how many activities are they delivering. When you look at GP practice productivity through that lens, it looks like practice productivity has been reducing. Continuity of care, this really important feature of primary care, has also been reducing over that period. And a very recent study published earlier this year suggests there may be a relationship between those two factors, that continuity of care might lead to improved productivity of primary care. And I think that's a really important insight. It gives us some opportunity to think about how we might solve this ever-increasing problem of access to primary care. Shall I skip across to the final column, the third column?
I'm sorry, did you? Oh, so we're on this one now. So third one across.
In terms of the importance of changing rates, is the actual number of consultation more important in terms of GP, outpatient, OHP capacity and planning? So are you saying, is it more important that we understand the capacity of GPs rather than the levels of activity they carry out? Is that the question, do you think?
Yeah, so I suppose it's more about, I think you need both, obviously, don't you? But this is, it sounds like it's more about the actual, the number of GPs needed, the number of OHPs needed to actually to satiate demand.
Yes, I mean, there's at some level a really close connection between those two things, because you need GPs and other health professionals to deliver consultations. But there are also other things that GPs and other healthcare professionals do, and that gets it, and how they do it, and that's that's the kind of topic we get into in the third paper in the series. Which I'll try not. If I try and do it in detail now, I'll do a bad job of it. So I'll maybe leave that for a later discussion.
Okay.
But yes, I think that's a really important question. Yes, how many patients now ring 111? Yeah, I'd love. I mean, I think there is a really, really important piece of work to be done about 111, what's impact on both primary care and urgent treatment centres and A&E. But that isn't something I've looked at particularly in this paper. But I think the system is crying out for a really thorough piece of work on the impact of 111 on services, because it is. I think it has transformed patient behaviour. And the question is whether it's done that in a positive or negative way, really. So we often hear that 90% of patient contacts in the NHS are in primary care. We don't really know what this is based on. Yeah, I mean, both, although there are differences in what the GP appointment rate trends, the NHS digital report, and the consultation rate trends that I've been showing in the more recent period. Before that, there was quite close alignment. And so we can be fairly confident about the overall level of consultations that are delivered every year. It's something like 300 million, and 300 million consultations per year, about 5 or so consultations per patient per year. And so you can set that alongside rates of outpatient appointments, for example, which are, I think, are closer to. Gosh, I'm going to put me on the spot now, but I think they're closer to roughly 1 per patient per year, for example, for outpatient appointments. So 90% is probably overstating it, but they are the dominant form of interaction between patients and other parts of the system. Were there any challenges with the population data? Yeah, so there's a question here about what the denominator of all these things is, whether they should be resident or registrant populations. And I do kind of explore that a little bit in the papers. One is higher than the other. So registered populations are always consistently higher than resident populations. So if I'd have used resident rather than registrant rather than resident populations, the rates would have been slightly lower on the chart, but the trends wouldn't have changed very much. But that is an important question. And certainly when you get down to ICB level, I think it probably becomes a more critical question, because the variation between resident and registrant populations become more marked at ICB level, and even more marked at sub-ICB level. So when I've done the work on relationships between need and supply of GP practice populations, I've used registrant populations there over the more recent periods. GPAD data set is available. Does this answer the question? I think yes, possibly. I think that's going to give us something very similar to what NHS Digital are reporting in terms of the appointment rates. I don't know GPAD really well, and if others have got a view on the extent to which that might help us answer some of these questions, then I'd love to hear from those people. But my suspicion is that it's going to suffer from the same problems as the other appointment rate data that NHS Digital report, which is that they may suffer from the same problem of overcounting those remote consultations, I think.
So we could either go to this one here. What are the questions this work is intended to answer from perspective of those who commissioned it? Yeah,
I mean, so I would see this report as kind of foundational for the other reports, which get into more detailed questions about what the implications are for ICBs and what they should be doing as a result of this. I think you can't almost answer those questions about primary care unless you've got a really reasonably grounded understanding of what's happened to consultation rates. So I kind of see this as foundational for those later bits of work. But just to emphasize that, a strategy to address the problems we're having with primary care, I think would be very different if we thought consultation rates had increased rapidly since the pandemic than if we thought they'd fallen rapidly. So really understanding that is a sort of foundational knowledge to help us address other questions. And I don't think we really knew that consultation rates had been in decline since 2012 until we did this piece of work. But there may have been some hints from other sources, but I think that's an important source of information as well.
Yeah.
So it kind of sets the scene for the more detailed piece of work that are addressed in the final two papers. Okay. And just to be clear, I do in the final paper in the series, I do sort of settle on some quite substantial recommendations about how we think about primary care policy over the next 5 to 10 years. So I haven't avoided that question. It just doesn't flow immediately from this piece of work. It comes from the later piece of papers. Yeah. Occasionally with the
yeah, sorry.
Do you want to try and pick up the last one, or have we got time for the last one?
Yeah. There's a couple of comments in the chat as well. So is it a quick one?
Probably not. No.
Okay. Well, I'll save that
in the
one
chat.
for
I can
you
see someone talking about triage, and I think that's a really important point as well. I think what we probably need, rather than this overall general notion of a consultation or an appointment, is some more differentiated currencies for primary care activity. And I think differentiating between triage and consultations, for example, would be really useful and help us get a much better handle on what's happening in primary care.
And then there was a question from Mohammed, which went back to the definition of a GP consultation. So you found it difficult to find out what was a consultation and what wasn't. In real life, it's easy. I had a consultation.
Yeah.
I didn't have a consultation. That was a letter. But there must be consistency in how that's derived from the data or the criteria used to get that from the data.
It is. I mean, I must. That could even be a session in its own right. It'd be quite a dry session, but there's a lot of detail in there. There are very, very long code lists within these GP practice systems, and the question of defining a consultation hinges on whether or not combinations of those codes should be indicative of a consultation taking place or not. But it's detailed, a lot of detail. You know, it's code lists, hundreds of lines long, that you've just simply got to sift through and decide subjectively or with reference to earlier papers whether or not you think that defines a consultation. I wish there was an easier answer to that question, but unfortunately, it is the devil's in the detail there, unfortunately. But it's detail we've got to crack for the future, I think.
Okay. Well, we're drawing to a close because it's nearly 12 o'clock. So thanks again, Stephen, for sharing that with us. I will definitely book you in for the next two sessions. I'm assuming there'll be one session each. And I also think that my newly arisen gap on the 25th is going to be of January is going to be a little bit too soon for that. I think the chief analysts will have received the paper by then, but it won't be ready for you to come and talk about to us. So we'll find a different date. So coming up in the next few huddles, excuse me, we do have demand forecasting for executives and professionals as seen at Hacker 2023. We have Andrew Jones talking to us about community service contracts, and we have information shared with us about the East Midlands Secure Data Environment. A few people want to know about that, so I'm glad that's coming up. I've got a very exciting sessions with which has been led by NHS Horizons, which I'll tell you more about next time. And just before we finish, just take a look at the training opportunities which are coming up. We've got spaces which have arisen on the Thinking Tools workshop in Birmingham with Fraser Batty on the 16th. It's only next week, but if you want to do a bit of sales shopping and you want a free lunch and also you want some fantastic training by something which is highly rated, then do register for that. Go to the website. Got some spaces on Zoe Turner's intro to R training and introduction to Git and GitHub training, also highly rated. See the training website for that. And Mohammed, I'm glad I put these on because Mohammed is definitely in the audience today. Also very highly rated is the Understanding Variation training, which is on the 17th, which is next week. That's online. And Understanding and Reporting Hospital Mortality Statistics. You need to have that information for you to understand what that is all about. And that is also with Mohammed, and that's in February. So I will stop sharing, I do believe, and we've reached 12 o'clock. So thank you very much, Stephen. Thank you very much, everybody, for coming. Thank you for saying it was a great session, Mohammed. Be back, very, very welcome. And I'll see you all in a couple of weeks. Don't know what we're going to be talking about, but I will see you in a couple of weeks. Bye, everyone.